I'm going to dig in on explanation of benefits just a little bit because it's a nice vehicle to talk about where healthcare data, which we oftentimes view as very constrained and limiting, can actually be the key to being really hyper personalized, as Adrian was referring to it. So if we did sort of a show of hands and said, what's the most boring document in all of healthcare, we might all say that the EOB is right up there. It's oftentimes, I'm glad I got it because at least they know that I went and had an appointment, but I'm not really dissecting it very much. One, because it feels like it requires an actuarial background, and two, because there's not really an action associated with it ever. But I think there are ways that we can challenge that. And if we think about the amount of space that we've got to meet that person where they are, personalize that we did in fact know that he or she had an appointment in recent time, then we know a lot about where they're at in their journey. And we know a lot about the next steps that they might be able to take. And this is before we're even asking the question of, well, what occurred in that appointment or what ailment might the person have been seen for. Just by virtue of having that healthcare interaction, there are so many things that as population managers, we want that person to do next. It's the right opportunity to say, let's go ahead and offer you a QR code to give you some instructions on what's next. Or to give you that step one, step two, and step three, you're just on the verge of completing that one. And so we're going to make it really simple for you to do that. You can see again how we go through and sort of dissect and map what are the behavioral principles and the personalization opportunities. It's that level of scrutiny that we really feel is where winning organizations are going to go in 2023. You will never get dinged for just sending out the EOB and calling it good. But you won't really advance against competitors or advance against the market if you're not taking these as opportunities to do a little bit better and put another sort of win in the engagement column. That's what we're looking at in terms of where the best organizations are really going to strive here. And if we really put on the healthcare strategist hat, what we're doing is tying our portfolio of benefits directly into a relevant healthcare interaction that a member has recently had. So if I do get an EOB back, and if you can see some of the line items at sort of top left here, if there's an A1C screening that we have coded for in that recent interaction, and as a health plan or a health system, my members or patients have access to OMADA, it is such a missed opportunity to not marry those two things together and say, hey, by the way, why don't you join the diabetes prevention program? Same if we were to go to musculoskeletal, same to go if we were the 10th time that somebody had been to the emergency department this year and somebody wasn't aware of their telehealth or urgent care opportunities. This marriage of CPT codes, which again, we've always looked at as maybe limiting healthcare data, it's right there for us to say, what is the next best action based off of the information that you've got here? Now, again, I'm going deep on EOBs, and it really isn't the point to say what type of a document. It's asking, what do we have available to us that we know can be a nice conduit to helping the member take the next action that's going to be best for them?
Yeah, and Drew, just real quick, just to complement that, right? I mean, if we're coming at this from a lens of, the printing and the EOBs and the member guides and the ID cards, not to take away from all the effort that the rest of the organization is doing related to emails and texting and, data capture in terms of mobile phone numbers and opt-ins and all the other techniques. The question to ask yourself is, but are we really mapping every single touch point with the consumer?
Yeah.
And if you are, why are we driving by these pieces? If you're sending them a card, a member guide, an EOB, why are we not leveraging those budget dollars? I mean, EOBs are pricey. I mean, you're sending 6 to 8 of those things out every single year per member. I mean, you're talking millions of dollars, and not to leverage every ounce of marketing lift and engagement lift from those seems like a missed opportunity. So that's all we're pointing out is, let's make these things actionable. This is not difficult stuff, working with the right teams. And I think you'd be amazed at the additional lift you're going to get from an engagement standpoint.
It's actually a really
Yeah.
good thought exercise. Like if you were to get into your biggest boardroom at your office and just lay out all of the pieces and print out the emails and print out the SMS and do all of those things and look at them and just be critical of, am I really moving the ball, or am I just checking the box that this got done? And when we say moving the ball, it's asking yourself, okay, are the behavioral principles here? Is this personalized to an advanced degree? Are we leading someone to actually complete a goal, or are we just giving them noise? It's a healthy thing to do at this time of year, and to think about. We know that the tightest competitors out there, their documents are going to look more like the ones we're seeing in this presentation. And so asking yourself if you're sort of in that echelon or not can be, I think, a productive exercise for teams.
Yep.
Sorry, Adrian, go ahead.
No, that's okay. I was going to say that, when we talk to clients, we often see that EOBs are their biggest print spend, right? And it's kind of a set it and forget it thing. They're complex documents. There's a lot that goes into them. So they're just going to leave well enough alone. But I think you guys provide a couple of very easy opportunities to just change small things about it so that it becomes more of an intentional and actionable document, right? It's not something you're just going to throw away anymore. All of a sudden you're like, you want to open them up and you want to see what that thing is that's now appearing that was never appearing before. So yeah, it's a unique idea.